know we love to help you live your best life on the show, and that includes all things wellness. So
Yes.
we've been focused on our heart health during American Heart Month, and just making sure that you guys know the risks of heart disease before it becomes an issue.
Yes, we're joined by Dr. Angela Britson, board-certified cardiologist at Franciscan Health. Dr. Britson, welcome.
Thank you.
Thanks so much for being here.
Appreciate the invitation.
I know a lot of us are thinking, yes, it's important to stay healthy. We know heart health is important, but you were actually saying there's a lot of misconceptions about it.
Yeah. You know, I think one of the most popular misconceptions with women and heart disease is that it's a man's disease. So actually, when you look at the statistics, in a year, 40% of women die of cardiovascular disease versus 25% in men.
Okay.
Wow.
I think the other misconception is for women that they feel like they're probably going to die more from breast cancer than it is heart disease. And 1 in 3 women die of heart disease. 1 in 31 women die of breast cancer.
Wow.
So there's a huge, discrepancy there. And I think a lot of it is how we go about prevention.
Okay.
We are, educated to do our breast exams. We're educated to get our mammograms. All of this is for prevention for breast cancer. What can you do to find it earlier? We haven't been so good from a heart standpoint to educate the public. What does a woman, she has a significant higher risk than a man. What can she do to try and prevent, and then to also know what kind of signs and symptoms to be aware of?
Okay, and so what are some of those numbers that women should know and check regularly with their doctors?
Yes. So number 1, blood pressure.
Okay.
Knowing what their blood pressures are running. It's a silent killer, so it's not necessarily you'll have symptoms if it's elevated. It's a long-term type of disease.
Oh, okay.
The second one is your cholesterol. What are your numbers? People will get them screened intermittently with their primary care physician. Not getting those numbers is another way of not knowing. What is your body mass index, or BMI.
Sure.
So obesity plays a significant role in the progression of heart disease overall. And then diabetes, so blood sugars. What is your fasting blood sugar? What is your hemoglobin A1C? All of those are significant risks that can create cardiovascular disease to progress over time.
Okay.
Yeah. As we look at these risks, the other question becomes, what part does family history play in a woman's risk for heart disease?
Yeah. So, one of the things that we screen as heart doctors when people are coming in is, what is your family history? What are the ages of your grandparents, your siblings, your parents, aunts and uncles, if you've had the requirement of a stent, open heart surgery, heart failure, something like that. So with coronary artery disease, we actually define premature coronary artery disease as an age in men 55 years or younger.
Okay.
Yeah.
Women have a 10-year further delay before that. So we say 65 years of age or younger is what's considered premature coronary artery disease for women.
Okay.
A lot of that has to do with the changes in hormones amongst menstrual cycles. So that change in estrogen and testosterone tends to have a detrimental role in the progression of plaque. So women tend to have that 10-year lag.
Okay, Dr.
That's good
Britson.
information to
Really
have.
good, helpful
Thank
information.
you.
Ladies, keep an eye on those numbers. Meet with your
Yes.
doctor. Get checked out. Yes, thank
Got
you
the
so much.
information on the screen right there. Thank you very much. We
Thanks,
appreciate
Doctor.
that.
Thank you.
And we love the red for heart health.
Yes, that's right. Hey.